Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is From Cancer to COVID-19, Does Science Self-Correct? And it will be presented by Ivan Oransky. Ivan Oransky is co-founder of Retraction Watch, editor-in-chief of Spectrum, and distinguished writer-in-residence at New York University's Arthur Carter Journalism Institute. Ivan previously was president of the Association of Healthcare Journalists and vice president of editorial at Medscape. He has also held editorial leadership positions at MedPage Today, Reuters Health, Scientific American, and The Scientist. He is the recipient of the 2015 John P. McGovern Medal for Excellence in Biomedical Communication from the American Medical Writers Association.
So what I want to spend the next bit of time doing is helping you with three different issues. One is to understand what's behind the rising rates of retractions. I suppose I'm giving a little bit away by saying that rates are increasing, but I think people know that. The second is to understand the role of what we call at Retraction Watch scientific sleuths in scientific correction. And finally, to understand, if you will, to pull back a little bit and understand what this all means in terms of polluting the scientific record or even the public health record or clinical decision making. Let me give you, I'm not going to go through all of these in detail, but these are a lot of the reasons that we see for retractions. They're not necessarily in any importance order or even percentage order, and this is not an exhaustive set of reasons, but again, you shouldn't duplicate your own work. It's considered quote unquote self-plagiarism. Obviously, plagiarism is bad too. There's some related issues here: fake data, image manipulation, paper mills, and to some extent even fake peer reviews. There's become clear that there is a whole industry of companies that are basically writing papers for authors or taking papers from other people and putting other people's names on them, using images or data that are from elsewhere. These are what are called paper mills. They're also basically managing to do the peer review process themselves instead of having an actual peer do it. And that's what we call fake peer reviews. I won't get into the story in detail, but it's basically where people create fake email addresses and then fool the editors into thinking, although this is much harder to do now that we and others have started writing about it for years, you manage to do your own peer review, which is, I guess, in many ways the dream, but obviously highly unethical. I'll just mention briefly legal reasons for retractions. We see lawyers getting more and more involved in these cases. I'm going to probably mention that in a bit. And so sometimes people either fight against a retraction, using an attorney, or sometimes people sue to have something retracted, although that's less common, or they threaten to sue. It's a very active area that certainly we're covering, we're trying to pay attention to. Okay, so let's say a paper is retracted, right? So great, like things have gone the way they should. Someone brought an allegation to a journal or to an institution or even the authors, and they decided to retract themselves, which is admirable and courageous and should be championed. And so, okay, so these papers are retracted. There are now, again, 3,500 retractions per year. There were last year. We'll see about this year. What actually happened? So does it all just, okay, nobody cites that paper anymore. People ignore it. Oh, it says it's unreliable. Let's make it's unreliable. Turns out not the case at all. So this was a paper that actually Alison O'Britis was the last author on. Alison is our researcher. She's in charge of our database. They looked at 265 articles that had been retracted in biomedicine, just in one, a large area, but in just one area. And they found, okay, the punchline here is that the retracted articles were cited nearly 4,000 times. And in only about, I again am saying science does self-correct and consistently, slowly, with little transparency. Again, to review, retraction rates have risen dramatically from about, maybe 40 a year in the year 2000 to about 3,500 per year last year. And even as a rate, that is a pretty big increase. Bad science continues to pollute the literature, both retracted and unretracted, but that, thankfully, sleuths are starting to make somewhat of a difference, and at least raising awareness and certainly leading to more retractions. And we certainly Retraction Watch appreciate that and want to champion that behavior and tell as many of their stories as possible.